The next topic which I'm going to do is fits. So what are the fits? So I'll keep asking question now. So if someone is coming with the fit, how would you start taking history? If someone is coming with the fits, so how would you start taking history? Guys, yes, write in the chat box. If someone is coming with fits, or like if someone presented first time with the fit, how would you take history for that? Write in the chat box. You will start with the Odipara, or will you start with, how would you start? If someone say, doctor, I had a fit, or someone have noticed that he's having a fit, so you write in the chat box. So if someone is coming with the fit, how would you start taking history? So I know you have like learned how to take history for the pain or vomiting or anything, but if someone is coming with the presenting complaint like jerky movement or eye rolling, fitting, so you will start taking history for incident history or collateral history. You need to start with that. Okay, so let me share my screen quickly. Yes, thank you very much, Aiza. You will start with before, during, after of that history. So you would be able to see that sketch. So you would say, first seizure, history of presenting complaint. So the patient would say that my friend, or like maybe you're talking to the friend or wife or anyone, but or might be straight to the patient as well. So if it's in the child, you'll be speaking to parents. But if you are speaking to any adult person, that he would tell the incident history that my wife told me, my brother told me, or whatever. So history of presenting complaint will come up with this jerky movement. The patient would say the jerky movement, eye rolling, fitting, tell me that thing in that way, it would come like. Then after that, tell me more about that, you need to ask question. You will take incident history before, during, and after. You will take an incident history before, during, and after. You will ask about that. Before, what happened, what you was doing at that time, and during that this incident, have you noticed anything? By any chance, you wet yourself, or you swallow yourself, any tongue bite? Do you think after that you was confused? Okay, is this happened first time, or do you anyone notice it? Anyone seen that? Anyone took the collateral history for that? Who witnesses? Remember everything? Any head injury? Do you remember, or have you fainted? You will ask all those questions in that part. So this is the best part, how you will take the history for the first seizure, or someone's coming with the seizure, or someone coming with the fall. You will take that history. So the fall history and for seizure history is almost similar, but you will ask that what has happened, what you was doing at that time. Another thing is differentials and red flags. You will ask about weakness, slurry speech, fast, any fall or bang your head, ongoing stress, any fever, problem with the light, neck pain, any rash, do you feel sick at the moment, do you have any early morning vomiting, or you would ask about that. And you will ask about flaws, problem with the walking, balance, and you will ask about, if she is a female, you will ask about period and pregnancy history as well. So these are the questions you will ask about the fit. Why it's important to ask about here? Because if he or she, like if you're going to see any female and you need to start any medication, you need to know that patient is having trying to get pregnant. Fast is F for face, A for arm, S for speech, and T for time. So this is basically mnemonic for rule out any stroke. Yes, you will ask about aura. I'll tell you how you will ask Anam about the aura and everything. Okay. And examination and investigations, you will ask about examination, what you're going to see, that what investigation you're going to do that, and you will verbalize it. At this point, I would like to do these type of vitals. I would like to see the nerve of your face, your legs, and all those. And then you will do the blood investigations, what blood investigations you are going to do that. You will mention that. Few you mentioned before and few you will mention after while doing the management. Explain finding. Firstly, is a jerky movement of body, often that cause is never found. 50% of people never have another episode, but further investigation is required. So you will mention that. Urgent referral to the first Urgent mean 2 weeks to the first fit clinic to confirm diagnosis will do the specialist test. CT scan, neurologist will see you and reassess you for seizure clinic. You may have further investigation, and if epilepsy is suspected, treatment option will be discussed with you. Advise first seizure leaflet until being seen by clinic. Please inform DVLA because you need to tell them, you need to inform the DVLA because you need to tell the DVLA because it could be dangerous for you. You cannot drive until being told by DVLA that you can drive or not, and until they have been given you permission to do so. This may depend on advice from a specialist. First aid, inform family and friends, relative to keep you, help you when it happen again, make a video of you, and if the seizure is more than 5 minutes, might need to call the ambulance. Always keep you calm, remove dangerous subjects around you, stop driving, but no hiking, swimming, extra, when to call 999. These are the things need to be assessed.